Assalamu alaikum, myself Talha Saleem, and the topic which I am going to discuss today is schizophrenia. Most of you have heard the term schizophrenia, but many of the people around the world, especially in the Asian countries, are unaware of the term schizophrenia. Like they do not properly understand what is schizophrenia. So before going on to the further description, let's see the statistics. Around 970 million people worldwide have a mental health or substance abuse disorder. Though schizophrenia is not as common as other mental health disorder, but it affects around 24 million people globally, and which is like 1 in 300 people are affected by schizophrenia. So now what is schizophrenia? So schizophrenia is a chronic mental health disorder which is severe and it can lead to psychosis. Psychosis is a term in which a person doesn't really have proper conscious, or he is unaware of his own consciousness. That is, he cannot differentiate between what's real and what's imagination. So this psychosis can leads to can affect how a person think, acts, express emotion, or even perceives reality. So this schizophrenia, as I told you, causes psychosis and is associated with the considerable disability and may affect all areas of life, which includes personal, family, social, educational, or even occupational functioning. So this can also lead, so the schizophrenic patient can also leads to the violation of human rights. That is, he is unaware of his own consciousness. So means that he can violate certain laws or rules that can lead to the violation of human rights or the discrimination. There are certain care options or like a treatment available for this schizophrenia, but it's like that 1 in 3 patients are able to fully recover with the symptoms of schizophrenia. So according to a study which was made back in 19th century, it stated that the schizophrenic patients have a larger caudate volume, a smaller left and right amygdala complex, due to which they have behavioral changes, and smaller left and right prefrontal volumes which affects their thinking, and also smaller right and left hippocampal complex volumes. Though was the only study which was made for the brain of schizophrenic patients, showing that they have a certain morphology within the brain. But this study does not fully support that schizophrenic patients have a change in morphology of brain. So now moving on to the symptoms of schizophrenia. So the early symptoms of schizophrenia appears in the 20th century, in the 20s, while in women the symptoms appear in the 20s and 30s. And the period when symptoms first appear to the period before full psychosis appear. That is, I told you about the psychosis. So this duration is called the prodromal period. So the prodromal period can last for days, weeks, or even years, and it can be hard to spot because there's usually no specific Trigger. You can only notice a few behavioral changes, especially in case of teens. So that doesn't only support the evidence that the person has schizophrenia. So what are the symptoms of adults? So in adults, there are multiple symptoms of schizophrenia, and these include the persistent delusion. That is, the person has fixed belief that is something is true despite evidence to contrary. So basically, in case of persistent delusions, despite knowing that everyone knowing that these are the true beliefs, it's like that the schizophrenic patient have delusions. Persistent delusions means they become unaware of the true concepts, or they started believing false beliefs or false reality. The next symptoms is the persistent hallucination. These do not appear usually in teens, but they are very common in case of the chronic or the late symptoms of schizophrenia. So in persistent delusion, the schizophrenic patient starts to smell, see, or even hear certain voices or people which are not even there. So this is the one of the symptom of schizophrenia, in which many of the people, especially in Asian countries, they started believing that this person is being possessed by some devil or demon or evil spirit. So before taking to the doctor, they take their patients to some other people's, and that is the point where the symptoms of schizophrenia gets worsen, or even the patient gets more worsen. So the next is the experience of influence or control or passivity. Means the schizophrenic patients start thinking that he is being controlled by someone else or some other entity. Means specifically, or even he or she can think that his information are being leaked by the FBI, or like he will he suppose that he is walking on the street and suddenly he started running, assuming that some agency is following him or trying to capture him. The next is the disorganized thinking and highly disorganized behavior. So highly disorganized behavior refers to that he can cry at very happy moments, or he may have certain emotions that are not, that should not be actually there. So basically, this person is not properly aware of his own emotions, and he can cry at any condition or even be happy at even the saddest moments. The next is the negative symptoms. That is the patient have negative symptoms in regards to that he will have lack of motivation or such symptoms. So, and the next is the extreme agitation. That is the schizophrenic patients have a unusual posture, especially like they are walking very slowly, or like they have bent necks. So these are some symptoms in adults. Now moving on to the symptoms in teenagers. So the symptoms in teenagers are usually common, which are that they are withdrawn from the friends or family, and due to the lack of motivation or depressed mood, they have a drop in performance at school, because this schizophrenia is affecting the patient or the teenagers' emotions or thinking, and they also have trouble sleeping. Though the delusions or like hallucinations are not very common in the teenagers, but still they can appear in some of the teenagers. So notice all these symptoms, and now let me tell you a thing, that these all symptoms can also appear if a person is taking certain recreational substances like marijuana, meth, or LSD. So these drugs can also cause the same symptoms as in case of schizophrenia. So we'll tell you about how we can, or how a doctor differentiate between the symptoms of such substances or the symptoms of schizophrenia. The risk factors of schizophrenia includes autoimmune system abnormalities, abuse during adolescence or early adulthood, like trauma can also be included in this, and the family history disorder. Basically, the schizophrenia can also be genetics, so it is also a lead role in the case of risk factors. And if a father who is in older age have a son or a daughter, that child is more likely to suffer from the schizophrenia. The causes of schizophrenia are usually genetics. So basically, like this schizophrenia can be transmitted from the parents to the offspring. The next is the brain chemistry and circuits. That is, the people with schizophrenia may not be able to regulate certain brain chemicals called neurotransmitters. So these neurotransmitters are responsible for thinking. So if neurotransmitters are not produced by the brain, so that can affect the thinking and the behavior of the schizophrenic patient. The third is the brain abnormality. That is, there could be certain brain abnormality like trauma or like a certain head injury that can lead to schizophrenia as well. And the last one is the environment. The environment is like drugs can also affect schizophrenia, but That's not usually the case. So in environment, usually there is viral infection or bacterial infection that can also leads to schizophrenia. Now the genetic defect, here's the part come where the biotechnology is especially related with the schizophrenia. So there are the genetic defects or the genetics are not much studied about schizophrenia, though there are multiple genetic changes are observed in case of schizophrenic patients. And this genetic changes includes deletion or duplication. The deletion can be microdeletion in a region called 22q11 in the chromosome number 22. So this region 22q11 is basically involved in a small percentage of schizophrenic patients, and some individual with this deletion can have other features including heart abnormalities, immune system problem, or even cleft palate. So, and they are diagnosed with a condition which is called 2q11.2 deletion syndrome. So when to see a doctor? So if you are noticing that your friend or someone from your family is having schizophrenic patients, then you must appoint a doctor. You must consult to a doctor. And these basically these schizophrenic patients are have lack awareness about their own disorder, so they can also have suicidal thoughts and behavior. So that's the point where you could play your role and help the schizophrenic patients by motivating him and by being and supporting him in case of his need. The diagnosis of schizophrenia basically are that if symptoms of schizophrenia are present, the doctor may prescribe blood test or brain imaging studies so as to rule out whether the symptoms which are appearing are even schizophrenic, or that these symptoms appear due to some other mental health disorder, or these symptoms can also, as I told you, appear by taking drugs. So basically, if a person is showing these symptoms, that is delusion, hallucination, and all these, so in within 6 months, so means that he can have schizophrenia. But one of the symptoms has to be delusion, hallucination, or disorganized speech. That is how you diagnose schizophrenia. See, so now the last part of this presentation, which is the treatment. So how can you treat schizophrenic patients? So there are no possible or no complete treatment of schizophrenia. Though there are certain treatment which can reduce the effects of or reduce the symptoms of schizophrenia. These treatment includes medication, and these medication which are taken by the which are given to the schizophrenia are called antipsychotics, and the old medications which were are called first generation are thorazine or haldol or loxapine. The newer medicines which are called second generation, which could be given to the schizophrenia, are Abilify, Aristide, and Cephris, and also there are multiples. Though clozapine is the only drug which is approved by FDA and is used for treating the schizophrenia at early stages. The next is the coordinated specialty care. So basically, it is a combination of medicine and a therapy by the help of which the symptoms can be reduced. The next is the psychosocial therapy. So these are basically certain groups, or like if you have seen in movies like psychotherapy groups or support groups. So be in case of schizophrenia, he or she have lack of motivation or something to do or a will to do. He could have suicidal thoughts. So these psychosocial therapy can help him uh, reduce the symptoms or motivate him so that uh, he can reduce the symptoms by himself also. And hospitalization, is that the schizophrenic patient should be admitted to hospitalization, because in case of severe schizophrenia, the patient may not be controlled by the family. So that's why hospitalization should be necessary for schizophrenic patients. The next is the electroconvulsive therapy, in which electrodes are attached to the person's scalp and a low amount of shock is given to the patient, due to which thinking or his behavior could be changed by the help of it. And the last is the research, that is, multiple research are going for the treatment of schizophrenic patients, and one of it is deep brain stimulation, in which doctors are using this technology to treat schizophrenia, and this can also be used to treat certain other mental health disorder like Alzheimer's. These are the references, and thank you. If you have any question, so do please ask in the comment section, and for suggestion the comment section is also open. Thank you.